Have you tried to get healthy, to lose weight? You wonder why you just could never get there. I want you to understand you're not undisciplined. We've all been sold a lie. The food industry, the big pharma, and even the healthcare system. I did not believe it at first until I heard this. They knew it all along. It's all designed to keep you sick, to keep you dependent. You want solid proof? Stick around. We're gonna expose all the lies right here. Today, I am diving deep into some of the biggest health lies that we've been told for decades. We have been so lucky to have interviewed the world's leading experts in the field of health and nutrition, and they're here to tell the truth. First on the list of the big lies, food addiction. We've all been told that dieting is just a matter of willpower, right? Dr. Joan Ifland, a leading expert in the field of food addiction, who spent over 25 years studying how processed foods affect the brain and body. Take a listen.
The tobacco industry came into processed foods in the mid-1980s. Now, you just look at this moment in history. 3 years, the tobacco industry, the two biggest tobacco companies, bought Kraft, Nabisco, and General Foods in 3 years. And all you have to do is like, whoa, why would people who make their money from addiction, so addiction is you sell a worthless product, you addict the person to it, and then they're compelled to buy it. So why would people who make their money that way move into processed foods? And you just see the whole thing become so clear. There's an addiction business model, and there's a process of addicting people to substances hidden in products. We know what happened.
Dr. Ifland's research shows that processed foods actually triggers the same addiction pathways in our brain as dangerous drugs and alcohol. And you bet that companies know this, and they hire teams of experts and scientists to exploit this. That's f***ed up. You think that's crazy? Wait till you hear this. This one is about cancer. Yes, the big C. Conventional medicine swears that cancer is a genetic disease. Dr. Thomas Seyfried, who is a distinguished scientist, has groundbreaking research that shaped our understanding of this deadly disease. He has this to say. Take a listen.
Yes, cancer cells have mutations. We all know that. But they are not the cause. They're the effect of the damage to the respiration. They can't live without fermentation fuels. So you just have to target that. And there's no clinical trials. There's no treatment programs or any of this that's testing what I'm saying. Because who's going to test this? The pharmaceutical companies that are making billions of dollars on drugs based on the somatic mutation theory? All those immunotherapies? Who's going to test this? The hospitals? They're locked into making great revenue from radiation and chemo and all this other stuff. Who wants to test a theory that could potentially reduce revenue generation for the majority of these institutions? Grants to the scientists from... So what we're saying, what people do in the past is you ignore what I'm saying. I'm not saying we can cure cancer. All I'm saying is we can provide an outcome far superior to what people are currently experiencing today.
Dr. Thomas Seyfried was on the record saying that a ketogenic diet along with conventional medical treatment for cancer could significantly prolong a patient's life and has the potential to even stop the growth of the cancer cells. That's life-saving. The lies doesn't stop here. It gets crazier. This lie is about the #1 killer in the US. Heart disease. The narrative they push has long been saturated fat and cholesterol. Dr. Philip Ovedia, a board-certified cardiac surgeon who has performed 3,000 heart surgeries, found out that it's also a lie. Take a listen.
Heart disease became the #1 killer in the United States. And we are 70 years into this fight. We have been giving the same message essentially for the vast majority of that time, that it's saturated fat that causes heart disease, that we need to lower our blood cholesterol levels, we need to eat less fat. But the evidence is exactly the opposite, because we do eat less fat, we do eat less saturated fat. Our cholesterol levels are lower. And yet heart disease is still the #1 killer. So we need to step back and say, why is this failing? We need to confront the fact that it was bad advice to start with. The theory, the hypothesis, which is what it is, was built upon faulty science, and the experimental evidence that is all around us is that it is not working, and we need a better approach. The bottom line is that there is no high quality scientific data that links the consumption of red meat to heart disease. Full stop. We have weak epidemiologic data is the only basis for that theory. We have to acknowledge the fact that the American Heart Association, the U.S. dietary guidelines, which are usually what are pointed to as the reason we need to be limiting our saturated fat consumption, both have said that there is no need to limit saturated fat, that it is not a nutrient of concern for overconsumption. They didn't really publicize that for 30 to 40 years, and then they just quietly backed away from that. I'm not saying that cholesterol is meaningless. What I'm saying is it's not the primary driver of heart disease. So eating red meat does not cause heart disease. Saturated fat in the diet is not the cause of heart disease. That should not be our primary focus. Really comes down to inflammation. Things that cause inflammation in our blood vessels, and those are insulin resistance, high blood sugar levels, things like smoking, things like stress can cause inflammation in the blood vessels. And that is what we need to focus on if we're truly going to have an impact on heart disease.
Dr. Ovedia has worked with countless patients, and he has seen firsthand how diet can actually improve someone's health and also reverse heart disease. He urges institutions that inflammation and high blood sugar and not to focus on cholesterol levels alone to prevent heart disease. So at this point, you must wonder, where the hell did the old diet and heart hypothesis came from? Right? Professor Tim Noakes, a highly respectable scientist and author, has spent years of his life researching and speaking out against this for decades. Take a listen.
I started reading about what the history was of how the dietary advice came around, and I could see that Ansel Keys, who was the main driver, was a crook. He didn't falsify evidence, but he didn't publish all the evidence that he had. When he had experiments that disproved his hypothesis, he hid them. The famous Minnesota coronary trial, which disproved the diet. I looked at the Women's Health Initiative because, ironically, the person in charge in America was a South African who was used by my trial legal team to try to find me guilty. And I discovered he'd hidden evidence. He'd hid in the Women's Health Initiative, clearly shows that the women who had heart disease at the start of the trial, so they're the most susceptible to damage. If the diet's harmful, it's going to show first in those people who already have established heart disease. And that's exactly what it showed. It showed that these women who had heart disease at the start of the trial, by the end of the analysis, they went for 13 years. They were a 67% increased risk of having additional heart problems. Mm-hmm. Now, when they came to publish it, they acknowledged that sort of indirectly. And they said, but if you were healthy, the diet was great. Didn't do good or bad, it was great. Mm-hmm. And they just ignored the fact that if you were unhealthy, it made you sicker. And that I've indicated that's the group you're really interested in. You're not interested in healthy people going for 13 years without developing disease. You're interested in the people who have disease. What happens to them? Because they're the ones at risk, and it made them worse. So they just ignored that. But it very soon came to me that the whole heart disease cholesterol story was a myth, and it was not scientifically based. It's diabetes that causes arterial disease. They're still saying the same old story because their careers are determined by making sure they're selling statins to the public. Because if they ever question, then they will lose all their funding, etc. And so then I knew that cholesterol's got nothing to do with heart disease. And it's the only people who would tell you it does are the cardiologists who are being paid by industry to promote these drugs.
Professor Noakes warns of the dangers of the use of statins, a cholesterol-lowering drug, which are prescribed to millions of people, damaging lives of the innocent. Now you know the truth. It was never about willpower. People used to be healthy until the food industry, big pharma, and the healthcare system found a way to profit off of keeping you sick. It's time that we stand up to the big guy, you and me, right? We can take our power back together. It will start through us taking control of our health. Educate yourself, clean out your environment. If you need help, there's plenty of resources out there. I have resources available to you down in the description box below. Remember, we're all in this together. You're not alone. If you like that video, give it a like, subscribe, and comment if you have any concerns about anything that was mentioned here today. If you have any requests for any videos, let me know down in the comment section below. I'd like to know what type of videos you're into. All right, and I'll see you next time.
Hey guys, if you enjoyed this video, give it a thumbs up, and if you want to learn more about the carnivore lifestyle, make sure you subscribe to my channel. And I'll see you on the next one, guys. Peace.